Scrotum piercings, what you should know before getting one done. Coming up next on Consultations by a Piercer, episode number 57. For those that are new to the channel, welcome to the Body Piercing and Tattooing channel. Hope you're enjoying the videos. Hope you find them helpful and useful, but you may not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio, located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. Before we get too involved in this, I do want to give a little bit of a disclaimer. I am going to be talking about a genital piercing. If you are not comfortable with that, if you're in a part of the world where that may not be acceptable or you're not of an appropriate age, I would suggest trying to find something else to watch. We have plenty of videos on our YouTube channel that have absolutely nothing to do with genital piercings that are informative, educational, and everything else. Now, if you're looking for something titillating and sexually exciting, you're going to be disappointed as well. The sole purpose of this video is education. For those that are considering this video or this particular piercing, not video, piercing, or maybe a partner, or maybe somebody that just wants to become more educated about body piercing in general. So let's talk about what this piercing is. It is a scrotum piercing. Basically, it's pierced anywhere on the scrotum area, basically done through the initial epidermis, the outer epidermis. There's kind of two pouches. There's the one inside and the one that's outside. We go through the one that's on the outside. We do not go into the inside. That could cause problems. Usually done with circular jewelry such as a cavity bead ring or a circular barbell. Average healing time on this could be 3 months or more. What we generally suggest, or what I suggest, is cleaning twice daily using a sterile saline spray. Neomed's Piercing Aftercare is what I generally sell here at the studio, and it's my favorite product. However, you can find other brands out there that are exactly the same. They're sterile, saline, in a can. The main things you want to look for is that it needs to say on the packaging that it is sterile. And when you turn it over, there's only 2 ingredients, water and sodium chloride, nothing else. If it has anything else in it, that is not what you want. And like I mentioned, it should be in a pressurized can. The difference between the Piercing Aftercare and other products, or some of the products, is how that spray is delivered. With the Piercing Aftercare, it comes out in kind of a fine mist. With some of the other products, it can come out like a super sucker, just super, like a squirt gun. And that can change how you apply it. If you feel comfortable just spraying it directly on the piercing, that's fine. If that's not going to work, a cold compress can work. Take a sterile gauze sponge, saturate it, lay it against the area for about 5 minutes, pat dry. With the, if you're just using the spray, you just spray it on there, let it stay in contact for about 5 minutes, and leave it alone. You can let it air dry if you want to. Now, the other thing I suggest doing is at the end of your shower, kind of present the area and let the water flow over the area for about 30 seconds. What we're doing with these two things is we're removing that discharge that's going to harden and crust on the jewelry, often referred to as the crusties. Everybody hates the crusties. The main reason we want them off there is when the jewelry shifts or moves, it can agitate the piercing, which can lead to issues. It also is very uncomfortable. It can be, it can feel like scabs being pulled off. I don't know how else to describe it. Not fun. And we need to make room for additional discharge if your body produces it. If you feel like you have an obsessive amount of discharge or it's just not coming off, don't run to the cabinet and start pulling out everything tipped in cotton or with a sharp edge or what was suggested by some stranger on the internet. See your piercer. Have them take a look at it. Have them clean it for you, and make sure there's not something else going on. Now, cross-contamination prevention. Common sense stuff. Mom should have taught you. Wash your hands before you handle it. No obsessive handling of the area. No oral contact or exchange of bodily fluids on or around the piercing for a minimum of 6 months. It's kind of hard to cover this area with a latex barrier. I'm guessing you could, but it wouldn't be very comfortable. But it's a good idea to at least practice some form of safe sex just to be on the safe side and kind of reduce the likelihood of an exchange of bacteria. Keep your environment clean, meaning clothing, bedding, towels, anything that comes in contact with the piercing needs to be cleaned on a regular basis. Do not submerge this piercing in bodies of water you cannot control the quality of, meaning pretty much everything but your own clean, well-maintained bathtub. Swimming, I don't suggest doing for a minimum of 3 months. There is no way that you can put that you can come across a body of water that you can stick your whole body in and move around and not find microorganisms. This is an open wound while it's going through that initial healing phase. And there is a possibility of one of these microorganisms working their way into your body and causing an infection. Keep pets away. Everybody gives me a good dirty look like, what are you saying I do with my dog or my cat? Basically, what we don't want is a situation where they have access to your bedding, your clothing, etc., sleep in the bed with you, etc. Limit the amount of contact they have with things that are going to have contact with this piercing. That's what our goal here is. Trauma, clothing, and abuse. Avoid constrictive or abrasive clothing. Anything that's going to get caught on it is going to get caught on it, possibly going to get caught on it. Loose fitting but tight. Basically what we're looking for is something that is loose fitting enough that it's not catching or pulling on the jewelry, but kind of adds a little bit of support to the area to limit movement. Movement can be a little uncomfortable at first. Do not sleep on the piercing. Sleep on your side or your back. Do not sleep directly on the piercing itself. Do not spin. Do not rotate. Do not play with the jewelry. There is no reason to do this. It's not going to speed up your healing. It's going to make things worse. The more you mess with that jewelry, the longer the healing is going to be, and the more likely you are to have an infection. Bleeding. Genital piercings tend to bleed a little bit more than other piercings. It's a good idea, at least for that first week or so, to wear a sanitary napkin or pad. The reason being, it cuts down the likelihood of staining clothing, bedding, etc. But it also adds a little bit of cushioning that can help during the tender phase. Another thing is, a way that I have saved some sheets in the past and mattresses and etc. is puppy pads. They're very inexpensive. You put them under where you're sleeping, under the piercing area where you're sleeping. They're not really uncomfortable. They're not like plastic sheets or anything like that, but they'll at least limit the possibility of that bleeding happening through your clothing and onto the bed. Risks. With this one, it is a borderline service-to-service piercing. They don't really reject that often, but it's always a possibility. And generally what it comes down to is the more contact the piercing area gets, the more movement the area gets, the more likely that's going to happen. However, I have probably only seen maybe 3 or 4 cases of slight migration, and I've never seen a piercing that I did, this particular piercing, reject. So your chances of the piercing healing are pretty good. But if you're one of those people that's very anal about how exactly it's placed, you might not be the piercing for you. A lot of these, including frenums, will kind of shift or move a little bit sometimes during the healing process. The other risk is sexually transmitted infections and diseases. It is an open wound during the healing period, so we have to be extra cautious, but understand when you're switching partners, that tissue tends to be a little bit more fragile than other parts of your genitalia. Also, it is hard metal through soft tissue, so there's a possibility of causing tears or slight problems that could reopen that piercing, and then you have an exchange of a virus that you don't want. So, when switching partners, always practice safe sex. And the last risk with this one is closure, and that's pretty much every piercing, but these can close pretty rapidly, regardless of how long you've had them. It's a good idea if you like this piercing to leave something in it. Sexual activities. Of course, gentle at first. If it hurts to do something, stop doing it, take a rest, try again, or try something else. Listen to your body. It's going to guide you kind of in the right direction. This piercing doesn't generally have as much contact as other genital piercings do, but it's a good idea to kind of be on the more cautious side at first, figure out what you can handle, what positions you can handle, etc., and then take it from there. Already mentioned the latex barriers and I generally suggest for the first 6 months, just to be on the safe side. Water-based lubricants are your best option. Avoid anything that has any warming gels, last longer, or any of those additives. they can cause reactions, including spermicide. So basic, just good old-fashioned water-based lubricant is your best option. If you're a little bit more on the experimental side, avoid straps, things that are attached to that area, etc. I have had clients that have issues with leather straps and etc. causing damage to these piercings. So keep them away, and do consider that when your piercer is marking the piercing. If you are somebody that uses this type of thing on a regular basis, you want to make sure that that piercing is not going to come in contact with that device or item or fun time. Now let's talk about anatomy, angle, and placement. This particular piercing can be placed pretty much anywhere on the scrotum. I generally try to avoid areas where there's going to be a lot of leg contact, because those tend to be a little bit more uncomfortable and get twisted and turned a lot. The placement is dictated kind of where it's located at. We kind of do it at a horizontal, so we have it so that the ring lays, or when the ring lays down, it lays downward. We don't want something that, like, we pierce over a ring and it's straight up and down vertically and it's just flip-flopping back and forth, because that's not going to be very comfortable. As far as its anatomy, the tissue needs to be loose. We need to make sure that we verify that we only have that outer pouch instead of having the inner one. Generally, it's pretty easy to detect, whether, one way or another. There's not really any anatomy reason that would keep you from getting this piercing done that I know of, but for the most part, it's a pretty common piercing, and most people can get it done. One final thing on placement: if you are planning on getting like a scrotum ladder or what have you, or additional piercings in the area, talk to your piercer about that before you mark it. Knowing that there's kind of a plan in spaces needed or things need to line up, it's a lot easier to do that if you're not coming back and there's like one scrotum piercing that's at a different spot in a different angle. It's best to let them know that, hey, my long-term goals are this, and let's plan out for them. Jewelry. With this one, we either do the most traditional way and most common way is with a cat bead ring. You can do this with a circular barbell, or I've even done them with curved barbells, and we've tried straight barbells. They're kind of, it depends on the anatomy and how it's going to fit in there. But usually kind of a circular or curved piece of jewelry is your best option. Of course, if you go with barbells, it needs to be internally threaded. That's going to be your best option for quality, and just basically it's usually just better. Now let's talk about pain and experience. On a scale of 1 to 10, a lot of people will say this is between a 2 and a 4. It's not a very painful piercing to get done. Usually you have the effect of, ow, that hurts, and then an immediate dulling of the pain. There's not that throbbing and aching that you get with even an upper ear cartilage or even an earlobe. This is going to be kind of a quick pain done. A breathing exercise can be very helpful to get you through the process. Usually what I suggest is take a deep breath through your nose and hold it, and then exhale through your mouth. Think of it as smelling, it's your birthday, you're smelling the cake and blowing out the candles. I suggest this piercing is done with forceps. It's the only way I've ever done them, and it's the only way I'll probably ever do them. The reason being is that it's kind of important to make sure that we've separated out those two pouches, to make sure that we're only piercing the part that we want to pierce and not that inner pouch. Also, this, because it can be kind of hard tissue to work with sometimes. Everybody's a little different, and making sure that you have that isolated tissue that only this is getting pierced and not something else, or that it folds on you or what have you, is a good idea, and limits the amount of possibility or risk of mistakes. Next, we have you do the Bevy exercise and then inject the needle in and through. Usually remove the forceps at this point in time. Insert the jewelry either using a guide pin or by blunt force, just putting it against the back of the needle and pushing it through. Close the jewelry, stop any bleeding that may occur. Sometimes these can bleed a little bit at first, not often. It kind of varies. And then basically Usually with this, I'll give you some type of a gauze or something to kind of put against the area until you can get somewhere and get pads. But you're done. Get dressed. There can be a little bit of slight tenderness off and on. Usually you don't have the throbbing and aching like you have with other piercings. Slight bleeding, but usually it fades pretty rapidly. Just think like a prick on the finger kind of bleeding. Every once in a while, you might nick a larger vessel and then have issues, but it's pretty rare. One thing I forgot to mention during the anatomy is checking for veins and make sure that they are not directly in the area. Lastly, let's talk about what you should consider before getting this piercing done. The first thing is that it's a good idea to kind of plan ahead. Wear some clothing that's easy to remove, shoes that are easy to remove if you need to remove them, and also clothing that if it gets stained, you're not really concerned about it. Like I said earlier, we want clothing or underclothing to be kind of loose-fitting, but yet supportive. Think boxer briefs. You don't have as much movement as you do in, say, boxers, but it's not like tighty-whities where it's really tight. If you normally wear the more like 1970s whitey-tighties or 1950s, I guess. That's when it started, didn't it? I don't know. It may be more comfortable for you. Just kind of experiment and see what works best for you. But it's a good idea to have these things kind of planned out in advance. Also, it's not a bad idea to purchase pads and just have them with you. You cannot sleep on this piercing during the healing time. If you're a stomach sleeper or that area of your body normally has contact with the bed, it's a good idea to kind of train yourself ahead of time to avoid contact. Just think about it. Try using different type of pillows, body pillows, etc., to keep you from rolling over onto your stomach and onto the piercing. If you are in a committed relationship or have an ongoing partner, talk to them before you get this done. It is going to affect their life for a little bit, depending, especially with the safe sex practices. Also, you may have a situation where there's certain activities you're not going to be able to do for a while until that tenderness fades and the piercing becomes a little more seasoned. So talk to them about that beforehand. The other thing is, I don't suggest getting piercings for surprises. Unless you plan far in advance. If you have a situation where you have a romantic weekend coming up and you decide that you want to get a piercing to surprise your partner, don't get it the Friday night on the way home from work to go out to dinner before you go to the hotel. You're not going to be in a condition where you're going to be able to do romantic fun time, and it would be best to wait either till after that happens or to plan ahead. Get it done 3 months beforehand so that it's healed by that time. The other thing is, as always, plan ahead. Talk to your partner, figure out what their feelings are on it. Some people have some very adverse opinions of genital piercings. This is not one that really adds a lot of sexual gratification to either the wearer or the partner. So it's more for aesthetics, more for looks. So take that into account. Talk to them about it. Get them involved and communicate like you should. Next one, it's a good idea to do this before you have a few days off from work. If you have a 3-day weekend coming up, hey, that's a perfect time to get this done because you're just going to be able to hang around the couch on comfy pants and do nothing. You cannot swim with this piercing while it's healing. Always take that into account in advance. If you are planning on going on vacation, it's usually best to wait until you get back. And the reason for that is there's a number of them, but the main ones are you're going to be in an environment that you're normally not in. You may not have built up an immunity to some of the pathogens that are in that environment. Also, you can't control how clean that environment is going to be. So you're kind of at the mercy of other people, and it could lead to problems. Also, most people like to swim when they're on vacation, and you can't. If you have a scrotum piercing or are thinking about getting one done, feel free to leave a comment with questions or let us know what your experience was like. Till next time, here's hoping all your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see you for your body piercing needs in the future. Have a good day, everybody. Take care, and we'll see you in that next video.